Hi everybody, it's Jessie. It is almost the 6th of November. I am about, I guess like 12 days, almost 11, 12 days shy of my 6-month post-op. And unfortunately I have some, I guess, kind of good news now, but not so good news at the time. Unfortunately in the last 2 weeks I've been in and out of the hospital a couple times. Apparently, for about a month now, I guess it has been, I was having all kinds of back pain and it was sort of gravitating toward the front, and I thought it had been because I was hit in February by an off-duty cop who rear-ended me and my assistant when we were on home visits. I work for Head Start, and we do home visits, 2 home visits a year, and parent-teacher conferences, and so we have to go out in the car and visit in all our homes, and we had gotten hit a couple months into the year last year, and on and off I've been having back pain here and there, but it's really been better since I lost a lot of weight post-op from the bariatric surgery. But unfortunately I had all this back pain, and it was sort of like underneath my shoulder blade, along the rib line, and it would go around to the front, and occasionally I'd have a little bit of stomach pain sometimes when eating, and I just figured it was my students stressing me out because we do things like family style dining. I didn't realize that there was a bigger problem happening, but the pain kept getting worse and worse. And on Tuesday, the last week of October, I started having pain when I was breathing behind my right breast and stuff like that. And so I was a little worried. And my doctor said, okay, you need to go to the ER because we need to get a chest x-ray and make sure you don't have pneumonia or anything like that. So I went, and sure enough, they ran so many tests: blood work, urine work, they did an ultrasound, they did a CT scan with contrast, they did an x-ray of my chest and everything, and so there was no infection. My lungs were totally clear. I have what's called exercise-induced asthma. That really doesn't usually bother me unless I'm sick. Even my lungs were completely clear, no wheezing, no nothing. The only thing they could find was that they said my gallbladder was mucked up or sludged up, and they also said that my lymph nodes and my pelvis were swollen. So they said, okay, take the pain medicine and go see your doctor in 2 days when I had my appointment. So they sent me home and everything. Still had quite a bit of pain, but they still sent me home anyway, from Jersey Shore, which is a local hospital to me. And I don't know if it was the doctor that I had, because I had a male doctor originally, and he was really thorough, and he was like, I want to kind of have more of a definitive answer for you as to what's happening and what's causing all this pain before I send you home. And then I got this female doctor, which I actually had in August too, when I was having terrible cramps and excessive bleeding and stuff like that. And she sort of, I just didn't really get the greatest vibe from her at that point, and this definitely solidified that some more for me. So I waited the 2 days. I went to my primary, and it was pretty busy in her office that Thursday. After spending 13 hours from Tuesday into Wednesday in the ER, they had sent me home, said wait till Thursday when I see my primary. Saw my primary on Thursday. I waited about an hour in her office. By the time I got in and saw her, I was in tears. I was in so much pain. My stomach hurt, my back hurt. I just couldn't sit still. I was so uncomfortable. So, and I really hadn't been eating a lot. I've been drinking more and having soup and stuff. I just really couldn't find myself getting into more solid foods, and it was just really not right. And so she said, no, that's it. And she admitted me pretty much right away. So I went right to the hospital, and I stayed there from Thursday to Saturday. Thursday and Friday I was in a lot of pain. In the ER, they give you morphine when they give you pain, but at Jersey Shore, they only give you 2, whatever it is, the gram, or I don't know what it is, the actual measuring implement. But once they admit you, they only give you 1, and even that wasn't enough for me pain-wise. So they did more tests. I was admitted Thursday evening, and on Friday they did what's called a HIDA scan. And the HIDA scan was solely on the gallbladder, and it was almost like a 4-hour test. And it basically showed that my gallbladder was not functioning. So they said, okay, at this hospital, they said, it's either one of 2 things. It's A, your gallbladder, or B, you have ulcers in your stomach. So we need to do a scope. So but basically they were saying that it wouldn't be both of those things. It couldn't be both of those things. It would be one of those things. So they go ahead with dismissing me. They, let me go. They released me on Saturday, because I wasn't in pain at that point on half of Friday and Saturday. I had pretty much wasn't in that much pain, if any. And then I was also more hydrated and stuff. So they let me go. Then I talked to my gastric bypass doctor, Dr. Schmidt's office, and they said, if you're having that much pain, that you're going to have to go directly to the ER and try to go in that way, because if they scheduled for my gallbladder to get taken out by Schmidt, I was gonna have to wait till January, which is just crazy to have to wait till January. I don't understand. So they said, just go in, bring all your test results and stuff, and complain of pain like you're in pain. And well, I didn't have to fake it. They were saying, fake it if you have to. I didn't have to fake it. By the time I got there, I hadn't had any Vicodin or anything, which was what they were giving me for pain. And I was like starting to die. Like I really was not comfortable. In the ER, they gave me medicine. They gave me morphine. They even gave me antibiotics just in case my gallbladder was infected and stuff. So, and they basically got me admitted pretty fast. I did have to wait in the ER at Hackensack Hospital for them to get me a room ready for a little bit, a couple hours. And then finally I was admitted into a room and stuff, and they started hydrating me. And basically I went into the ER on Monday and had surgery on Tuesday. Now after my surgery, on Wednesday morning, they did an endoscope basically. I can't speak, endoscopy, and endoscope, and they went down my throat. They put me out, they went down my throat, and sure enough, I had an ulcer as well. So whereas the first hospital was like, okay, the train of thought is you won't have two things, it'll be one or the other. My gallbladder had to come out, and I had an ulcer, or I have an ulcer. It's not something they can just cut out and get rid of. So basically I have an ulcer that connects where the stomach connects to the intestines from the gastric bypass. They're testing the ulcer to see if I have something called H. pylori, which apparently is a bacterial virus that a lot of people get. It's not like super contagious, but it's something you get if somebody has it and they make your food and you eat it. It's almost like getting giardia from drinking the water from food handling and stuff like that. But apparently it's very common. They don't know that I have it yet. They sort of think this is sort of routine coming with the gastric bypass. But so that's kind of where I am with things. So I had my gallbladder out. I have 4 incisions, one in my belly button. They're all on the right side. And, so I have let's see, stand up so you can see. So there's, 1, 2, 3, and then one in my belly button. It's pretty okay. Like it's definitely, it was done like laparoscopically as well. So they're not huge, but they are a little sore. It's not kind of like when I was post-op bariatric surgery the first time on the left side where they put the camera in and everything. It hurt really bad there. It's not, it's more sore on that top right section. So they took my gallbladder out, and I have to drink this lovely stuff to treat the ulcer. And I had to take Nexium, and hopefully in about 3 months, they're hoping that the ulcer will be gone. They're going to rescope me again in 2 months. But this is Carafate I have to take, and it's before I eat, about 15 minutes before I eat. It's to coat my stomach and try to help it heal from the ulcer. I don't know, hopefully in a couple days I will find out about the biopsy result. They didn't test for cancer per se. They said in a couple months when they rescope me, if it's still there and it still looks suspicious, then they'll test it for cancer. But right now they're just really worried about the H. pylori thing. So if I do have the H. pylori virus that caused the ulcer, they will treat it with like I think they use a combination of 2 antibiotics, and they mix it with like a Pepto-Bismol kind of concoction, but he's more thinking that it's along the standard line of gastric bypass caused, basically. So before the bypass, I was having a tremendous amount of back pain. It would come like once a week for like a couple weeks, usually sometimes twice a week. Usually Monday and Tuesday would be my worst days. And so I asked them, I'm like, well, what would cause Monday? And they said, well, maybe you eat a little bit more indulgently on the weekends, like more foods with high fat and that kind of thing. Don't know.